Viewer from Alexandria notes that there are shortages in healthcare employees, especially in nursing, and wonders about whether or not the legislature should be helping fund educating nurses. Of course, the governor made an announcement, I believe, yesterday about proposed additional expenditures to assist in the training of new doctors. So this topic does have some legs. Let's talk a little bit about it. Representative Hackbarth?
You know, I shouldn't be talking about it because I don't know that much about it. I really don't. So.
Well, this is Health and Human Services.
Yeah,
you, Senator Nino. Yeah,
I met today. I mentioned this earlier. I met today with a couple of representatives from the long-term care initiative, and this is one of the things that's on their agenda for the session, is to create some incentives to make it easier for people to get into and get through their training. We do have a challenge in the nursing field in general. I mean, the average age of nurses is going up and up. I think it's about, I forget the number, but I want to say it's almost like 60 years old now. The average age of nurses is getting older and older and older, and we don't really have the infrastructure to backfill all of those positions. We've got bottlenecks, and the challenge is particularly difficult for nursing homes because they can't, and I don't want to get into funding policy, but because of the way we fund nursing homes, they can't pay the wages that a nurse can get paid at a hospital. So if you have a 4-year nursing degree and you're working at a nursing home, you can go across the street to the hospital and they'll snatch you up and pay you $5, $10, $15 an hour more. And if you've got a 2-year nursing degree working at the nursing home, you've got a strong incentive to finish that out. So you can go across the street, get your 4-year degree, go to the hospital, and get paid $20,000 or $30,000 a year more. So there is a real challenge there, and it's even worse in greater Minnesota.
And another thing that I'd like to add to that, Senator Nino, is there's been a bill introduced for a community medics, I believe it's called, community medics, where EMTs and paramedics that exist now can do some of these things at some of the nursing homes and things like that, I think. Is that how
yeah, there's, I haven't seen the specifics, but there's been a number of proposals along that way.
To try to fill that gap.
And that really has been anyway, those kinds of proposals have been promoted by the more rural legislators, because that's really where there's a significant problem.
Governor's proposal to fund doctors go anywhere, do you think? Hard to tell.
Hard to tell. You know, if it's in his budget that's on the table, you know, we'll see on Tuesday what he's got.
All right.